from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Okay, welcome back, everybody. Here on Good Morning Arkansas this morning, we're talking with Baptist Health cardiologist Dr. Scott Davis. And we're sharing some heart benefits, some health benefits overall, but we're not talking about exercising today. We're not talking about diet today. We're not talking about a lot of things we typically talk about. Instead, a healthy relationship and how that can benefit your heart. That's pretty interesting. And your health. Yes, I know.
You own one of these.
Feeling good about it right now.
You
really
are,
good. Always feeling good about it, of course. Yes. But right now, especially after reading this information and the information you're going to talk about today, this is interesting.
Well, we're talking about the benefits of marriage, right? And so there was an interesting retrospective study, observational study, published in Heart, which is a division of the British Medical Journal, looking at over 2 million people in some 30 different studies. And they looked at the benefit of marriage. And look, we know that 80% of cardiovascular risk is related to genetics and high blood pressure and diabetes, but there's about 20% that can be affected by a social network and, your relationships. And so there was a over 40% benefit to the married group compared to the non-married group. In other words, 40% reduction in cardiovascular risk compared to non-married folk. Now, understand this is a large study.
Yeah, 2 million people is a big
It's a
group.
lot of folks. It's retrospective. Now, what it did not look at same-sex relationships. It did not look at partnerships as far as living together but not being married. But it did, it was a robust observational study that looked at marriage and then non-marriage and then divorce. There was a 35% increase in cardiovascular risk in divorced population versus the married population. And so granted, as we always say with these kind of situations, more data needs to be, discovered and more investigation needs to, go into this. But, it begs the question, okay, why? And you start then kind of peeling back that part of the onion and you start looking at, well, having a mate and having a partner then to observe just changes in behavior or react quickly if you do get sick, that's helpful. The stressors that are related to divorce, for instance, have been shown to then increase, the propensity for stressors that might relate to increased risk for heart issues or stroke issues. People have speculated that dual income homes may provide better health care coverage. So there's a lot of factors that go into it, though. But it is encouraging that, marriage is beneficial to your heart.
There you go.
Now, does that mean that it's going to be part of the American College of Cardiology guidelines saying, yes, we prefer you to be married or not? Yes. No, but
I see you're struggling right now.
But for all the cliche, things about marriage and, it's wearing me out. Actually, it's not, because it's good for your heart.
Yeah, we always... one of the things in the guy world is, men who are married statistically have a lower mortality rate.
That's right.
Overall. We're not talking, which is absolutely understandable. But it is interesting that just a healthier heart for both parties is something that could be beneficial. What about genetics? Anything in that play a role in the study?
Now understand, they teased all that out. So they separated out, genetics and hypertension and diabetes and smoking and all of the common risk factors, and still found that marriage, there was some 40% difference in the married population versus the non-married population.
Okay, I have some other data here. People who were married, 42% higher risk of developing cardiovascular disease if they were not married.
Compared to the non-married,
And then 16% higher risk of developing coronary artery disease.
Right, and here's the other thing. In the widow population, there's about a 15 to 20% increased risk of stroke in the widow or the widower that is still survived. Yeah.
So someone who is survived after has an increase. So a broken heart, like literally, we've talked about it before.
That's it. So it's not to say that you need to rush out and get married.
we cannot encourage that, especially with the statistics in today's divorce rate, right? Yes.
But with that said, you can have some at least reassurance that your marriage is at least heart healthy.
Okay, there we go. Yes, and like he said, this isn't official medical. This is something there's a big study and something that will be followed up on, I'm sure, with many other studies behind it. Dr. Davis, we always appreciate when you stop by today. Great to see you as well. You can contact Baptist Health anytime at the number on your screen. It's 1-888-BAPTIST. You can go to baptist-health.com too. Their website is an easy way to go online, find out more about the programs, which they have amazing programs over at Baptist Health to help you keep on amazing. But it's 1-888-227-8478.